A silent crisis is unfolding in the Philippines. HIV is spreading throughout the country.
We have more than 500% increase.
And the hardest hit are those just starting out in life.
Just in the first quarter, about 70% reported people who had a positive result were in the age group of 20 to 34.
This is a concentrated epidemic.
There was no one I could talk to about it.
Why are so many Filipino youths getting infected? And what must be done to save this future generation?
I first suspected that I had HIV way back in 2021. Around September of that year, I experienced this flu-like symptoms. They were really severe to the point that I asked my mom to bring me to the hospital. My fever was high, it reached around 38, 39 degrees. It wasn't COVID. The doctors couldn't figure out what the reason was. During that time, it was a thought that was lingering at the back of my head na, what if this is HIV? I had risky sexual encounters a couple of months back, and this could be it.
Jigo, who is using an alias, waited 3 months before getting an HIV test at a government clinic. Tests done after this recommended window achieve a more reliable result. The result was as he feared.
It was a really dark moment in my life when I found out about my positive status. For the next few days, I couldn't eat. I was mostly like staring through blank space. There was no one I could talk to about it. I never thought of telling it to my mom or even my siblings because I don't know how to explain it to them. They didn't even know that I was being sexually active, much more having an HIV positive status.
Jigo is one of the many youths in the Philippines who's living with HIV, also known as the human immunodeficiency virus. He's part of an alarming trend. Between 2010 to 2024, there has been a 550% increase in HIV cases in the Philippines. From April to June 2025 alone, the Philippines had close to 5,000 newly reported HIV cases. That's an average of 55 new cases each day. The Philippines now has the fastest growing epidemic in Asia Pacific. What's worrying is that among those newly infected, 80% are under 34. The overwhelming majority were male, with the median age being 27. Over time, HIV can develop into AIDS, acquired immunodeficiency syndrome, a deadly disease. It's now also known as advanced HIV disease.
So it's really alarming because these are people who are still about to start their lives. They're starting to become productive members of the society, and they have the disease.
Yet, what's happening in the Philippines is an anomaly. Across Southeast Asia, HIV rates are showing a decrease in most countries. It's rising sharply only in the Philippines. To understand why the archipelago is the outlier, we have to first look at how the virus is transmitted here.
You get infected through sexual contact, through blood transfusion. If the mother is infected, she can transfer it to the baby. We call it vertical transmission. Or if there's exchange of needles through injection drug use.
In the Philippines, 96% of HIV cases are acquired through sexual contact.
I started being sexually active at the age of 21. How I did it was actually by using one of the more popular hookup apps here in the Philippines, which was Grindr. So using Grindr, it was actually really easy to find someone else who wanted to hook up as well.
I think the youth right now is more sexually exploratory. Usually, they actually look into to online sexual contents. They engage in applications. It's more accessible right now to find a partner than before, compared during the old days without those apps.
In the early 80s and 90s, the HIV epidemic primarily affected female sex workers and overseas workers, especially seafarers. But since 2007, a shift has occurred. Men who have sex with men, or MSM, now have formed the majority of new infections.
It's a focused epidemic, mainly in this population. They have more sexual partners, so the spread amongst the community is faster. So it's like a wildfire. When one is infected, the spread would be fast.
Before, it actually affects the general population, which are heterosexual people. Right now, there might be less media coverage around it because it's a more marginalized population that is affected.
So, despite the rapid spread of HIV in the Philippines, knowledge and awareness about the disease is low. A 2021 survey found that over 70% of young Filipinos have heard of HIV, but only less than 20% had comprehensive knowledge of HIV transmission and prevention. More than half think HIV can be spread through sharing food with a carrier, which is false.
They think that LGBT people are the only vulnerable community in terms of HIV, and they think that straight people or cisgender are safe because they're not LGBT. They are still thinking that HIV can be transmitted through hugging, kissing, sharing of utensils.
Back then, when I started becoming sexually active, the knowledge that I had about HIV was actually very basic. I knew that it was a virus, that we could get it, or it could be transmitted sexually. But I didn't fully understand the consequences or the effects of it. Most of my knowledge actually was from the internet. HIV, or even sex, is a taboo topic here in the Philippines, even up to today.
So why is HIV and sex considered taboo in the Philippines? How does cultural conservatism explain why HIV is exploding here while decreasing elsewhere? It's almost showtime at the Apotheca Club in Makati City in Manila. Backstage, 28-year-old drag performer Mix Chanel is getting ready. Mix's claim to fame was an appearance on a reality TV show and now uses their platform for advocacy. Mix is one of the few openly HIV-positive drag performers in the Philippines.
There was a headline recently here in the Philippines of there being a 500% increase in people being diagnosed with HIV, and a large demographic of it are kids, are young teenagers, early teenagers. And it's very alarming because we're not teaching these things in public schools. We're not normalizing conversations about sex at home.
So now I'm able to more openly talk.
As an ambassador for Love Yourself, a HIV non-profit, Mix speaks about disease prevention at events.
There are so many social and economic issues I think can be addressed just by educating people and making conversations around sex more normal, less taboo, less frowned upon, less shameful.
Since 2018, sex education is mandated by the government for public schools for kids aged 5 to 18. Youths are supposed to receive information about reproductive health, sexuality, and STD prevention. The goal was to curb the rising rates of HIV and teenage pregnancies among the young. Yet, HIV numbers have continued to climb.
We believe that it has not been effective in curbing the increase in HIV transmission. There's lack of full implementation. The 2018 guidelines were only pilot tested during the pandemic, but there was no rollout nationwide. So in terms of sexuality education, we don't know if DepEd has been able to cover the 100% of the entire learner population from primary schools and secondary schools throughout the country.
Yes or no?
There are teachers who are not still trained about sex education. We still encounter conservatism. There are groups that are saying that it's not right to teach young people about sex.
In 2023, a bill was submitted to the Senate to expand sex education and provide sexual health services. It was known as Senate Bill 1979.
So Senate Bill 1979 was the 19th Congress version of the Prevention of Adolescent Pregnancy Bill. If we would summarize, it has three key provisions. One is the strengthening of the comprehensive sexuality education, which is very important. Another important provision is access to services. So it addresses the gap in the law when it comes to young people's access to modern family planning services. And the third important provision is social protection for adolescent parents and their children.
The Philippines has the second highest number of teenage pregnancies in Southeast Asia. The bill looked to address this, but it faced opposition from both politicians and the public, particularly around comprehensive sexuality education, or CSE.
Comprehensive sexuality education is the teaching of sex, sexuality, reproductive health, and sexual health and rights in an age-appropriate and development-appropriate manner. A conservative group opposing this measure came out saying that teaching CSE, because it's based on international standards, would teach children how to be promiscuous, on top of that, early masturbation. And it strips away the authority of the parents from rearing their children.
In a media interview, a spokesperson for the conservative group, Project Dalisay, said CSE intends to normalize sexual discussion, which is not part of Filipino culture.
Studies abroad have shown that evidence-based comprehensive sexuality education module doesn't lead to early sexual activity, but in the Philippines, usually there are some connotations around it. The conservative groups are branding it as destroying the innocence of children.
So, sex education in the Philippines is not straightforward. Though almost 3/4 of Filipinos support teaching it in schools, it remains a hotly debated topic. Why?
I would say that religion plays a very, very transformative part in the Filipino culture. More than 80% of Filipinos are Christians, okay, are Catholics particularly. And that deep-seated part of religion really plays in our everyday life. It's a moral compass and an ethical compass, for most of Filipinos. The values that we hold on in our life, as we are more family-oriented, we are more person-oriented, we still hold on that sex is something sacred. We still hold on that sex is a gift. And the sexual activity is a gift from the Lord that the church would say will hold on to the teaching, it is for procreation.
In 2012, the Church fought a reproductive health law that expanded sex education in public schools and made contraceptives, including condoms, available for free at public health clinics. When used properly, condoms can reduce the risk of HIV transmission by 95%.
The church would not regard condom use as a moral and a real solution to stop HIV. Because it can never be said that if you use condom, then we will stop HIV. The church would go for letter A, that's abstinence, okay? Especially for those who are not married. And maybe for those who are married, then be mutually faithful.
Yet, despite the Philippines being broadly religious and conservative, there exists a contradiction.
It's weird because in Filipino media, sex is so sensationalized. Like celebrities that have like sex tapes or scandals leak, it's so sensationalized. A lot of our like soap opera stories are about adultery. Like that's the weird dichotomy of like conversations of sex in the Philippines, where it's kind of like this mysterious but exciting thing, but you're also not allowed to do it until you get married.
According to one survey, over a fifth of Filipino youths between 15 and 24 have had premarital sex. This jumps to 1/3 for the urban population in Manila. So, while outwardly socially conservative, Filipino youths are more sexually active than their counterparts in Malaysia or Indonesia, for example.
We are still largely a conservative country, I think externally, and the older generation would want to believe that and would want to hold on to that. But there's refusal to acknowledge that young people may no longer have the same values. Young people are engaging in sex, and the median age of sex is 18 years old. I think that the state needs to provide the necessary information to protect young people because this is their behavior.
Following opposition from politicians, Bill 1979 was resubmitted to the Senate for passage. The CSE portion was narrowed by removing the phrase, guided by international standards. Where does this leave sex education in the Philippines?
Both camps believe that it is the parents who have the primary responsibility of teaching that to their children. But I think what the opposition is forgetting is that it's not all Filipino parents are able to talk to their children about these things, that children do not go to their parents to seek advice regarding sexuality.
Here, conservatism and taboos could again pose a challenge. One study found that only 1 in 4 Filipino parents has had any discussion on sex and related matters with their children. Another study found that only 1 in 10 Filipino youths has ever discussed sex with their parents at home.
But you know, parents only know as far as they know. And if parents also were not brought up having these conversations around sex being normal, they will not be carrying that on to their kids. So if the parents don't know, how will the kids learn?
In the absence of comprehensive information about sex and HIV prevention, youths are left to their own devices. 44% of young Filipino females and 39% of young Filipino males lack material sources of information on sex. Among those who do, for 31% of males and 26% of females, social media is their top source of information.
Since the right information is not coming from right institutions like schools, they will get information from the internet. And they may get misinformation or fake news from the internet. So we're just putting them in danger and at risk.
Of course, education is important, information about HIV and other risky behaviors is important, but there's no point in knowing how to prevent if young people are barred from accessing, for example, condoms, family planning services, and other modern contraception.
Though condoms are readily available at convenience stores and government health clinics, more than half of Filipino men are embarrassed to purchase the contraceptive.
Sometimes even the cashier is going to give you weird looks, like, ooh, someone's going to get laid tonight.
It has been a long discussion regarding condom use, access to condom. It's not even placed in very accessible areas in stores, no? So it's probably because of the high influence of religion in the country. So advocating for condom use is equated to encouraging promiscuity.
Legislation may hinder access as well. Under Philippine law, minors under 18 are prohibited from purchasing condoms or getting them from health facilities without parental consent. The Philippines is the only country in Southeast Asia that has such a national law.
Their parents are gonna ask about where are they going to use it, or they might even be attacked, they might even be sanctioned for it, might be penalized at home, like removing your allowance. Those affects the accessibility of this stuff that could actually help curb down the HIV crisis.
Consequently, condom usage is low. In one 2022 study, 30% or less of the male youth surveyed used a condom during risky sexual activities.
Based on survey, the key population said that they don't need a condom. Maybe this is because of that lack of information about the transmission of HIV. Second is because of the spontaneity of the sexual act, so they don't like it. And then the third is the inconsistent use of condom. So it means that they are not using the condom correctly.
The stigma around sex extends beyond education, reaching the medical aspects of treating and preventing HIV as well.
Kasi 17 years old ako nung nakulong kasi yung father ko. Tapos, kailangan kong suportahan yung pag-aaral ko. So, meron nag-alok sa amin ng work sa Olongapo. Tapos, ang sabi doon is mag-waitress, ganyan. Nung pagdating namin doon, ang naging trabaho namin, entertainment, ganyan. Nag-entertain ng mga customer.
Olongapo City is situated in the central Luzon region of the Philippines. Back when the US military had a heavy presence in the area, Olongapo was known as the Philippines' Sin City. It was here that Rika found a boyfriend.
Si partner yung unang nagkaroon ng sintomas. Yung ubo na palit-ulit na hindi nawawala, kahit gamutin namin, hindi siya nawawala.
With the cough persisting, the couple sought treatment at a government clinic.
Tapos, sabi doon ng nurse, magpa-test kami for HIV. Ako naman po, confident naman po ako kasi hindi naman ako nakikipag-sex kung kani-kanino and loyal ako that time.
However, when the results came back, both Rika and her boyfriend tested positive for the virus.
Nalungkot ako, para akong pinagsakan ng langit at lupa. Kasi nga, ilang taon lang ako noon, 18 years old, kakatapos ko lang din mag-birthday nung taon na yun. Parang sabi ko, ayun yung gift ata sa akin, grabe yung nangyari. Tapos, nakausap ko si partner. Sabi ko, after namin i-test, kinausap ko siya. Sabi ko, bakit hindi niya sinabi sa akin na meron siyang HIV? So, ang thinking ko kasi, sabi ko, baka alam niya na meron siya. Pero pinaliwanag niya sa akin. Sabi niya, hindi rin siya aware about HIV. Doon din lang din niya nalaman na meron siyang HIV. Doon din lang din niya sinabi na nagkaroon siya ng, ang work niya is sex worker. Kumbaga nakikipag-sex siya sa kapwa niya lalaki, sa gay, ganyan, tapos sa babae, gano'n. Multiple partner rin yung naging ano niya. Kaya nagkaroon din siya siguro ng HIV.
Prostitution is illegal in the Philippines, but the country has a huge sex trade. It's estimated there are 400,000 sex workers in the Philippines. Poverty is widely cited as the most significant driver for entering the trade.
Yung dito sa Pilipinas na involvement ng sex workers, no, at very high risk sila dahil sa multiple engagement with different people. So, as usual, kung mas marami kang na-engage na tao with unprotected sex, mas tumataas yung risk mo doon.
Many sex workers face pressure to comply with clients' demands, including refusals to use condoms in exchange for higher payment. One study of female sex workers found that 4 in 10 had inconsistent condom use. But the illegal status hampers sex workers' access to HIV prevention measures.
So, sex work being illegal in the country creates a lot of barrier for the sex workers first to come out and seek services. For example, in countries where sex work is not illegal or at least it's decriminalized, sex workers would have regular checkups. They would have health certificates saying that this is their HIV status, for example. They have access to social hygiene clinics. That is not possible for sex workers in the Philippines. The other one is they don't get tested because they're afraid, because of the stigma and because of the risk of being put to jail. Then they don't know their status. And because they don't know their status, there's a risk that they can get it. They can transmit it to another person.
There have been efforts to decriminalize sex work and instead go after clients and traffickers instead. However, bills introduced in Congress have stalled over the years, in part due to political and cultural opposition.
We have to acknowledge that even if it's illegal, it's happening in the country. So decriminalizing sex work would, in a way, help regulate the industry. The more important aspect of that would be sex workers having access to services like healthcare, social protection, without the fear of being jailed or imprisoned.
For Rika, she and her partner had to reckon with their condition.
Ang question namin dalawa, mamamatay na ba kami? Nung nalaman namin na na-test kami, nadala na kami para sa treatment, sa hub, chinek yung CD4 namin, yung resistensya namin, ganyan. Kung ilan na. Sa akin kasi yung CD4 ko noon 200 plus na lang. So mababa, hindi siya normal. Dahil ang normal na CD4 dapat nasa 500 pataas. So yung partner ko naman sobrang baba. Ang CD4 niya nasa 27 na lang.
The virus infects the immune system, so it affects the cells in the body called CD4 cells. These are white cells that are responsible for protecting the body from common infections like tuberculosis or other opportunistic infections. What HIV does, it lives inside the CD4 cells and it divides there. Slowly, the person's immune system goes down. If it goes down to below 200, so that's the level where we call it advanced HIV disease, previously called AIDS or acquired immune deficiency syndrome. So that's when patients will have opportunistic infections. It's called opportunistic because when you have normal immunity, you will not have these infections. But if your immunity goes down or your CD4 cells goes below 200, then you get these infections.
3 months after their diagnosis, Rika's boyfriend, died from an infection. Since January 1984, there have been close to 10,000 deaths of people with HIV. The largest proportion of reported deaths were among 25 to 34-year-olds.
These are young people. They're just starting their lives, so they should not die from something that is preventable. We're somehow partly responsible by not making sure that stigma is being worked on, or sex education is not discussed, or there's no healthy discussion of sex.
Stigma means that testing is relatively low in the Philippines. At a national level, the country has set a goal of diagnosing 95% of people with HIV. As of June 2025, it's estimated that less than 60% of those with the virus have been diagnosed due to insufficient testing.
A lot of people are not getting tested, even if testing centers are everywhere in our country, because they're afraid they will be judged when they approach the facilities. They can get discriminated because of their HIV status.
We have been seeing the youth, many of them being tested positive now of HIV. And the first move of the church is really to care for them, to break barriers of stigma and discrimination so that they can access health services after testing. Why? Because they're also our brothers and sisters. They're also humans. They're part of the church. They're part of our community.
Diagnosis not only prevents the spread of disease, it can also save lives. Medical science has come a long way. Though HIV is still incurable, medication means it is no longer a death sentence.
ART is antiretroviral treatment, or ARV, antiretroviral drugs. So what it does, it kills all the accessible virus such that the CD4 cells, the immune cells, are allowed to flourish. So they become, their immune system becomes normal again, so they can live healthy lives.
In June 2025, only 66% of people living with HIV in the Philippines are on antiviral medication. This is below the regional average of 77% and far from the country's target of 95%.
There are also problems of accessibility, or sometimes they face discrimination and stigma even in social hygiene clinics. So it's really important that the people who are providing information and services are from the community, so that their sense of familiarity, you're making HIV or sex education or conversations about sex more comfortable and normal.
Rika has been on ARV medication for 6 years. Her immune system has recovered, and she has even found a new partner who is accepting of her HIV status, though the disease still impacts her life.
And hanggang sa nagkaroon kami nag-decide kaming magpamilya. Nung una, may pa ako na baka mahawa nga yung magiging anak namin. Sinasabi rin ng pamilya ko na baka magkaroon din si baby.
Rika sought advice from her HIV support group, the Association of HIV Positive Women Advocates, Inc., or APY.
Yun, ang lagi lang sasabi sa akin ng doktor ko, lagi niya sinasabi sa akin na, Miss Rika, hindi ka mahawaan, hindi mahawaan yung anak mo, basta inumin mo lang yung meds.
In the end, Rika's pregnancy was smooth, and her child was born free of HIV.
With ARV, you can become undetectable. The virus can be undetectable in your blood. Undetectable equals untransmissible. Treatment with ART is actually treatment for the person and treatment for the community as well, because it prevents transmission.
HIV is now preventable and manageable. So, what must be done to get this epidemic under control in the Philippines. At the office of the Philippine Anti-Discrimination Alliance of Youth Leaders, or PANTE, concern hangs in the air.
We're supposed to train at least 30 individuals that will be providing this life-saving initiative service of HIV screening. But because of the Trump's memo on withdrawing or cutting the funding, the activity was suspended.
Organizations like PANTE provide a safe space for vulnerable populations to come get HIV testing and treatment. However, their services are now at risk of funding cuts. In January 2025, US President Donald Trump ordered a sweeping freeze to all US foreign aid worldwide. In 2024, USAID approved close to $7 million specifically for HIV epidemic control in the Philippines. The government has said it's exploring identifying various domestic financing sources to cover the shortfall.
Actually, it has a big impact because most of the US funding supports the health human resources for some of the local government units at some of the treatment facilities. These are the case managers, the peer navigators, and the encoders. So it has an effect.
So imagine, because of the funding cuts, we have to stop our advocacies and initiatives, the services that we provide. Most of our audiences are young people, so we're not giving young people the services and information because of these cuts.
Kasi yung US yung usually nagpa-fund for free PrEP. Ngayon yung mga bottles na available namin dito is donations from private organization dito sa Philippines.
Cuts have reduced the availability of PrEP and PEP, drugs that can be taken to prevent HIV.
PrEP is pre-exposure prophylaxis. So even before you have sexual relations or you need to take the PrEP, it prevents you from getting the disease if you have a risky behavior. So PEP, on the other hand, is post-exposure prophylaxis. That's, you get it within 72 hours from having the risky behavior or risky sexual relations.
When taken consistently, PrEP stops the virus from replicating in the body, reducing the risk of HIV infection by about 99%. However, the uptake has been low. While close to 70% of Filipino MSM surveyed had heard of PrEP, yet only about 18% use it.
So the stigma to one being MSM, being a person having sex with men, is very high still in the country. So the stigma of being promiscuous is also high. So the one is stigma. Two, it's access. They don't know where to get it, even if most of the treatment hubs provide it.
The US funding cuts come at a time when HIV rates are projected to rise. At the end of 2024, the government reported that there were more than 210,000 people living with HIV in the Philippines. But if prevention and interventions aren't scaled up, this number could balloon to over 440,000 by 2030.
First, it will be a very heavy toll on the health system, the health budget, and of course, loss of a lot of young men who are productive, who are contributors of the society, you know?
HIV is already a concentrated epidemic among young people, and not being able to prevent and treat HIV would therefore have a really serious impact on the health of our country, of our young people.
Actually, sinabi na meron ng Napag-usapan na namin yan doon sa aking hub na ganyan, napag-usapan na namin na nakakatakot yung pagtaas o pagdami ng mga positibo o HIV dito sa bansa natin. Kasi nga, baka dumating yung panahon, mag-itip-tipi din na tayo sa pagbigay ng gamot.
In May 2025, the government launched the Philippine HIV Prevention Roadmap, a 5-year plan to address the country's growing epidemic. The plan sets out 10 key action points. These include scaling up evidence-based interventions, strengthening community-led services, and removing social barriers.
For the youth, it's the information education campaign. And then we're also looking into the opt-out testing, especially for the age group of 15 to 24 years old. Opt-out testing is that we will be including HIV tests with a routine test, and it will be done if the patient, after explanation, if the patient agrees.
However, the most difficult challenge remains tackling the cultural roots of stigma.
We have to encourage studies or evidence on the extent of knowledge, and then, of course, develop more accessible education materials for everybody, especially the young people. So in platforms that they will access, like TikTok, YouTube, because these are the platforms that young people access now. So they should have somehow guided education from these platforms.
Other people should not be discriminated in accessing information, services, particularly healthcare, just because of their diverse sexual orientation and gender identity. And that's important for children to learn at an early age, because they will carry this along throughout their lives.
They see HIV as a health issue. But if we see it as a social issue, all departments of the government will dip their finger in the ball. Department of Education, Hazen Education, which is a very, very effective HIV prevention, awareness, okay? Values formation, the progression for the children, progressive modules for the children. Put in and invest in that. Not only money, but also human resources. Train teachers on it, train counselors, on it. Put in other partners, on the table for dialogue. Okay? This is a whole of a country approach. Okay? So I'm faith-based. The church must be on the table. The community must be there, meaning those people living with HIV. Okay? We have to recognize them that they are part of the community. Put them on the table. Listen to them. Okay? They are not only the beneficiaries, but they are part of the solution.
For MIX, they continue to volunteer their time, speaking up at various events, trying to break the stigma around sex.
It's really awareness. It's really education. It's really starting to break that shame stigma around conversations around sex in general, to have it be a more open conversation. And for it to be a more open conversation, it has to also be a well-educated conversation. So it really has to start with kids being educated. It's such a cultural thing. It has to start somewhere, and it's going to take a few generations for it, unfortunately, I think, to get to that point. But we have to start opening up these conversations. We have to start really advocating for better sex education, earlier sex education here in the Philippines. Because whether or not we want it to, it's affecting our kids.